Well, hello again. It's Jason Renault with the Alternative Mobile Services Association, and today AMSA is talking with Kaelin Rappaport from the Center for Law and Social Policy. Welcome, Kaelin.
Thanks for having me, Jason.
Kaelin, we're going to talk about the report that CLASP has created about youth and mobile crisis, but let's get started by getting introduced to you. Tell me a little bit about you and how you came to this place.
I came to this place after getting my PhD in cultural anthropology, and I- I'm a leading edge fellow with the American Council of Learned Societies, and they paired me with the Center for Law and Social Policy in DC.
Well, fantastic. And so you're in DC, and um, you've been with CLASP for a while, or just fairly recent?
It feels both like a long time and short time. We're at the year and a half mark now, but I feel like I've fit in well.
A lot of people talk about the compression of time at this moment. The time is shifting fast and slow. Tell me a little bit more about CLASP.
So CLASP, or the Center for Law and Social Policy, is an anti-poverty organization, and they seek solutions to improve the economic conditions for marginalized communities. And so there are several different policy teams in which they try and push that policy and provide technical support and advocacy, or they contribute to many different advocacy efforts, right? And so I happen to be both on the public benefits justice team, as well as the racial equity team. There's also staff that work in childcare and early education. There's people who work on immigration policy. Um, and there are also people who work uh, um, on education, labor, and welfare justice policy. But in my role, I've had the opportunity to sort of flip between these teams, and very happy about that.
So we'll have the website for the center in the show notes here. What brought the organization to my attention was a new report on youth and mobile crisis and the importance of development of youth services, mobile crisis services for youth. Now, some states have done this, some states have not. You've done a survey, but more, do you have recommendations about how it ought to be? Can you walk us, and the link to the report will also be in the show notes. Will you start to walk us through this report?
Absolutely. So I came into working on this report several months into my time at CLASP. And so these guidelines are really the result of a pretty large collaboration between multiple staff members at the Center for Law and Social Policy, with people at the National Collaborative for Transformative Youth Policy, as well as local youth and adults in Prince George's County. Um, CLASP has been working in the youth mobile space since 2019, and that was under Whitney Bunce and Clarence Oko. I mean, Isha Weerasinghe, who's my
Hmm.
current supervisor, um, as well as as well as Deanie. And so they've been in this space for a long time, and this document has been several years in the making. Um, and so we sort of surveyed some of the youth mobile uh, response programs that were out there and tried to marry them to various ideological concepts that we think are missing from most Western biomedical, you know, uh, responses to folks experiencing mental health challenges.
Uh, let's dig in right there. What do you mean by that?
By which part?
The different ways of looking at the mental health system or the mental health services.
Absolutely, right. And I should explain also what I'm talking about by Western biomedical.
Hmm.
Um, from my perspective, I look at the colonial and racial capitalist, sort of threads that are woven into what most people, I think, in the United States would consider to be, the medical system, right?
Mhm.
Or this larger medical industrial complex in which care is sort of married to like this capitalist value, right?
Mhm.
So how can we ameliorate people's conditions in a way that still turns profit, right? And so when the goal isn't necessarily health or like well-being for well-being's sake, right? That then sort of changes the relationship of what care looks like and who provides the care, right? And like who has access to it and who does not. Um, and we were trying to be cognizant of that when we were trying to put together these guidelines because still maintaining that racial capitalist framework, right? There are people who are or people who are marginalized more often than not in the sort
Mhm.
of axis of like intersectional experience, right? So it's usually non-white, poor Black and brown folks who suffer the most of like adverse health consequences, adverse health experiences over their lifetime for a number of very historically and contextually rooted experiences that we can also get into. Don't have access to appropriate care, right? And just like deal with this of this different, or not different, but this disparate, mental health burden. And some of these guidelines, like healing justice or transformative justice, or like an anti-colonial framework, right? Um, seeks to, sort of provide these guidelines for a mental health system that caters to youth and acknowledges, right, these historical, contextual relationships.
So, and you're speaking of direct services here, the actual medical services or social services, but this could also be pulled back and say that we've had a Euro-colonial perspective on the development of all the administrations of these services as well.
Absolutely. And that's sort of one of the main things that we were trying to do with this was really trying to advocate for a non-carceral response to mental health challenges and crises in the United States. Um, with many of the mobile responses, to my knowledge, they're like co-responder models,
Hmm.
right? Or people would think to call 911
Hmm.
if one of their loved ones or someone that they know is experiencing, a severe mental health crisis, right? And so there's so much research out there that tells us that at no stage does involvement by the police lead to people being safer, right? Or it's actually quite the opposite, right? So letting people in, or when you let police into the hospitals or at the point of arrest, or even with this extra police training, right, that people keep calling for now, right? None of this has been shown to correlate or lead to improved improved health outcomes for the people who are suffering from mental health challenges or from those around them, the community at large.
So you're really looking at questioning some of the basic principles of public administration here. So
Absolutely.
beyond direct service, the legitimacy of police in interacting with people who have any kind of health issue is or are not of majority culture.
Absolutely. And with that in mind as well, I think it would be great for folks to think about if you live in a community that's already heavily policed, right, or surveilled in some way, let's say by CCTV or these flock cameras, or you know, there's like a high prevalence of people that are forced to wear like an ankle bracelet,
Mhm.
right? If you come from one of those communities, it's already more or Hudson Buehler put out this article in 2013 saying that communities with high prison admission rates have higher rates of generalized anxiety disorder and a multi-depressive disorder, right? And so not only that, these folks are also dealing with this like crucial rupture that happens when you just rip somebody from the community and cut their ties of social support and peer support, right? Like when they're incarcerated. And it's also documented by many different researchers that peer support is a tool, right, for improving mental health, right? So you have this multi-directional path in which the presence of the police or like the carceral apparatus or state in general, however you want to call it, is tied to people's worsening mental health rates.
It's a big framework to get started on. And so you took to taking this and as I'm thinking about this, I'm thinking, when we think about what are the big solutions for the mental health system, we look to Finland or Italy or other sorts of nations that have really continuing this tradition of Caucasian culture.
And that I think happens a lot in this sort of Western centric,
Mm.
sort of like lens or this sort of like an abstract, like an academic eye. And even though that's my background, I think being in this position at CLASP, um, you know, a, we're an organization that provides like research and technical support, not necessarily the direct service, right? But we want to support the provision of the direct service, right? And so I think partnering with the other folks involved in putting this document together um, reified for me that we have the answers here, right? Like people have already been doing this work, and successfully for decades, right? But I think that the issues that usually arise have to do with sustainability and scale,
Mm.
right? Like how do we make sure that these programs have the support that they need to work successfully, because you can't really compare a sort of one-off pilot
Yeah.
program of people doing this for free or like not being compensated at the right rate versus a system that's part of the fabric of society.
Mhm. Well, now let's take a look at the report that you've put together. And could you walk us through the guidelines here?
Absolutely. So there are six sort of pillars in the structure of the guidelines that we really wanted to make sure are part of a mental health response system that caters particularly to youth, right? That also keeps in mind these various sort of ideologies and perspectives that we've been talking about before in the conversation. So the first one of those is a 24-hour crisis stabilization or like an observation bed. And so that's just so that people experiencing mental health challenges or a severe mental health challenge or severe mental health crisis have somewhere to be that's not in jail or that's not in prison, and somewhere where they can receive some kind of medical attention to try and restore their agency or to try and ameliorate their experience, right? And so the second part of these guidelines is to have this crisis hotline that's always available for people to call. That's not 911. That's not plugged into the 911 operating system, right? Because even if you have 911, these operators that are trained to divert folks like from the police department or from the emergency department, right? Like they still might be more inclined to make the decision to send people that way if they have the discretion to even have that option on the table. And so this, whether that's a 988 line, even though I've heard things about those also being plugged into the police or like the 911 sort of operating system or people's information being shared, right, in ways that might lead to them being incarcerated. Um, and to address the connection I mentioned earlier between, high prevalence of mental health challenges and being unhoused, right? Being able to provide short-term housing for people to be able to be stabilized, or just to, have time to sort of get on their feet, right? I think would lead to a lot of a reduction in people's usage of emergency department services or hospitalizations, and time spent incarcerated, right? Um, and then, so there are some other pillars as well, or some other points in this guideline. Um, People having a psychiatric advance directive statement filled out already. And this is basically people preemptively putting together a care plan for when they experience uh, some sort of crisis, right? And so that could be who to call, what sort of care you will not accept, right? Um, and things of that nature.
Mhm.
And there's also these warm lines, or this concept of warm lines is sort of built into the 24-hour, 7 days a week available crisis hotline, right? We want people to also be able to be connected to community-based support services, right? Still, again, separate from this larger carceral system. And then our last point would be to offer peer crisis services. And so this piece in particular, I think, is very significant because, to my knowledge, peer support is not built into, most people's health system that they can access. But they're like health insurance through employment or being able to walk into some sort of clinic, right? They're not necessarily c connected to someone they would consider to be a peer. Like per the conversation we were just having about, um, this Eurocentric, like white dominated space in the medical industrial complex, let's say. And so peer support has been shown as a tool for improving someone's mental health, right? And that's severed, if they're just forced to be um, forced to be institutionalized, or if they're taken into jail, right? Um, and this also sort of bleeds into this concept of like cultural appropriateness, right? Whereas with this peer services or peer crisis services, right? Like ideally, if someone sees someone from their neighborhood or someone in their community, right, or people want help from folks that have gone through something similar sometimes, right? Or like are more likely to receive that kind of advice or that kind of wisdom because this person has also gone through something or has lived a similar life with the same sort of experiences. And so we think that peer crisis services are very important in these guidelines and in, future health systems that meet the needs of youth.
So often we're really trying to build trust, and a friendly face in a crisis builds that trust to allow that person in crisis just to sustain a moment longer.
That's a great way to narrow down what I took so long to say. Absolutely. Yeah.
Well, Kaelin, congratulations on the creation of this uh, great report. Looking forward to more work in the future.